My name is Nguyen from the University of Oklahoma Health Sciences Center in the Department of Radiation Oncology, here to present our project Enhancing Medical Student Interest in the Oncologic Fields via a novel third-year elective. To begin with, medical student exposure to oncology is generally limited. Radiation oncology specifically typically lacks its own third-year clerkship and is often offered as an optional elective rotation with no tie-ins to medical or surgical oncology. At our institution, radiation oncology used to be offered as a 4-week elective when other electives were 2 weeks, which did not appeal to many students since it took up 2 elective blocks. Due to these issues, we have piloted a 2-week multidisciplinary rotation for third-year medical students encompassing radiation, medical, and surgical oncology at our institution. The purpose of the rotation is to increase exposure of medical students to oncologic specialties to foster career decisions, as well as to increase understanding of the multidisciplinary collaboration that takes part in oncology patient care. We created the 2-week rotation, which we broke up into 3 days of radiation oncology clinic days, 2 days of radiation oncology didactics, and the remaining 5 days scattered between medical oncology and surgical oncology. All students were given a pre and post survey graded on a 5-point Likert scale. The rotation focused on diagnosis, patient interaction, treatment planning, and multidisciplinary collaboration. Here's an example of a rotation schedule over the 2 weeks. We tracked medical student progress with the bingo card. Students were required to complete 75% and encouraged to complete 100% of it. All students were given the survey graded on a 5-point Likert scale prior to the rotation and on the last day of the rotation. In addition, we asked them to rate their interest in pursuing a career in oncology before and after the rotation. 7 students enrolled in the rotation from July 2021 to December 2021. 100% of students completed the rotation and surveys. We further divided the survey results into categories, including ability to perform a patient workup, comfort level with communication with oncology patients, level of understanding of radiation therapy, and comprehension of the role of multidisciplinary collaboration. All categories had a statistically significant increase on the Likert scale when comparing post to pre-surveys. Initially, 3 students expressed interest in a future career in oncology, whether that be radiation, medical, or surgical oncology. This increased to 4 students on the post-survey. However, 1 student who originally expressed interest on the pre-survey became undecided by the end of the rotation. As a whole, the rotation helps students gain knowledge about the oncology specialties as reflected by the post-survey results. The number of students' interest in oncology as a career also increased after exposure to this rotation. As for future direction, we hope to see further integration of the oncology specialties in the future. Ideally, we would like to see students follow 1 patient as they undergo their treatments from surgery to chemotherapy and radiation therapy. We also hope to continue to identify students who are interested in oncology and foster their interests even after the rotation with mentorship or involvement in research projects. Finally, we'd like to see adaptation of this rotation nationwide.